I think you all know, if not, you're about to find out, that almost all of my work is in qualitative data collection. Um, it didn't really start out that way, and it certainly that's not the limit of my skill set, but as it turns out, if you do qualitative, you do more qualitative, you get known for qualitative, you do more. But I will tell you for lots of reasons that that's what I really enjoy. And it's exactly for this reason. It gives more insight into why. And I want to understand why. So I think that's why I am a qualitative researcher. Um, and I will, I just wanted to give you my thought on this. Qualitative, the planning is easy. Not if you do it correctly. It might seem easier. I've had many quantitative researchers say, "Oh, well, you just go talk to people." Well, yes, but I don't just go to talk to people about anything. I mean, I do plenty of that, but I mean, I really, when I'm doing research, it's a whole lot of planning. And so it can be the planning, and especially if you're talking about recruiting community members for focus groups or interviews, that planning and upfront work can be very, very time consuming. Just really as time consuming, I think, as the quantitative. Also, he's definitely right here. This analysis is time consuming and difficult. I don't know if I would say it's difficult so much as it's time consuming. It's definitely time consuming. I think if you're well trained and you do it a lot, just like he does, I mean, if I did quantitative, I'd probably be really great at that too. But I think, it's are really quick at that too. But it's
Grad
not
student.
necessarily what.
You just hire a grad student to do it.
Yeah, that's what I do when I have to do the quantitative stuff. I do think here it helps to generate hypotheses. There are no statistical tests. Do not interpret that to mean it's not rigorous. That does not mean it's not rigorous. And there's growing acceptance in the scientific field. And I think what I found interesting is I was recently at a meeting and we were looking at the MPH programs in the school. And we need to, and there's a need with the new SEAF criteria to have more qualitative. And nobody could come up with a required course that talked about qualitative research, except for I talked a little bit about 715, which is required for our students, but not universal. So it really occurred to me that students in our school are probably not getting much here. I think HPB students maybe have more access to qualitative researchers, and there's a qualitative research class in HPB. But so yes, I think growing acceptance in public health and just science in general. Also, this is a slide that was used yesterday. Soft data, I don't know. To me, that sounds like it's not as serious and it's not as rigorous, but it's definitely storytelling. It's content rich. It's usually primary data, though sometimes you can get secondary data and analyze it. I think truly this is the other thing I love about it. It is working with communities. Absolutely. It does show the depth and breadth of an issue, and it helps you understand the numbers. And it definitely provides the basis for quantitative studies. Often we use results from focus groups in order to design surveys or even interviews. So we might ask a question that's open-ended, and then we use those responses later to design interviews. Any questions so far? Um, so can you list the methods just really quickly, type and list them, all the methods you can think of when you think of qualitative data collection methods. Can you quickly type in what you think of as those methods? Okay, Dom, for the record, glad to know it. Focus groups, yes, that's one. In-depth interviews, correct. Surveys can be qualitative, yes, or have qualitative questions, yes. And the interview guides are part of the interviews. Anything else?
Windshield surveys.
Oh, windshield surveys, yes. So that, but anything else? Probably the first one, and that's kind of what windshield survey is observation or is an observation survey. But participant observation is a very commonly used strategy. Yeah, walking tours, good, yep. But participant observation is actually really commonly used. We use it a lot in our evaluations. We spent a lot of time with the groups that are actually doing the work. So, for instance, I'm lead on the evaluation team for um, for a project that 6 of the Eat Smart Move More local coalitions, and we actually go and observe their trainings. We go and observe their coalition meetings, and we take notes. And we do a lot of other things that records what we see as participants. Um, so that is very commonly used. Interviews, focus groups, and document review. So if you will recall, and none of you came up with that, so document review is a strategy that we often use. So Kelsey mentioned the action plans that each of the coalitions does. We actually use those as data. So we actually get the action plans every 6 months for the communities, the 6 communities in the Let's Go project, and we actually review those so that we don't have to spend time. Actually, it's the coalition leaders' time. We don't have to spend their time getting that information. We can actually review the documents. So that's an example. And then case studies we use sometimes, and often they can include qualitative and quantitative data. This is certainly not an exhaustive list, but this is a pretty good list of the different methods. Observations, I've shared a little bit about observations and my experience in doing observations, but I will tell you, I've taken multiple classes in qualitative measure. So, and I guess that gets back to that point of being rigorous and scientific about your observations. And we generally take a lot of what we call field notes, and we also a lot of times will develop checklists. I work on the evaluation of the fitnessgram project, and that involves fitness testing in public schools in South Carolina. So we wanted to see how the teachers were implementing the testing. So we met with to develop the observation tool. We met with people who were experts in the fitnessgram, and they helped us design an observation tool. And then we went out and we actually observed what we saw. We had a check, so we knew what we were going to look at. And we had a checklist, and then we had certain areas that we wanted to particularly know. So sometimes you just go and just take notes of what's happening, and sometimes you have a very specific checklist and things that you're looking for. It really depends on the situation. And also I use participant observations really particularly to develop relationships with those who are involved with the programs, because I have found that I get a lot of great information by just talking with people and establishing relationships with them. And then when I want to do things that people that are a little more challenging or require a little more effort, I actually have established this relationship, and I think people are more likely either to respond to me since I've used that opportunity to get to know them, as Kelsey said, get to know something about the community, and I think that makes a big difference. I think you get better information and better support for the things that you do, um, the other measures that you're going to use if you've established those effective working relationships. Um, I think there are a lot of advantages to observation. It helps me understand the context. It helps us, as I said, establish the relationships. It helps us figure out if there are unanticipated outcomes. So whenever you're working with communities or you're implementing interventions in communities, there's always the intended outcomes, and then there's always the unintended outcomes. Some of you, as you've developed your research questions, I've asked you to think more broadly and not try to put the solution to the problem in the research question, and that's part of that same kind of concept. You don't want to, you want to look and think broadly about these things so that you're not missing unexpected or unintended consequences. So you don't, when you ask a survey, you're limited, to probably the intended consequences. And maybe if you've looked at other research, you might know some unintended consequences. But if it's really unexpected, you're not going to get that out of a survey. It absolutely, it actually takes highly skilled, highly trained people to do this effectively and well. And it's very resource intense. So it's pretty quick and easy and inexpensive to get surveys, but to have actually somebody skilled go out and do observations is pretty labor intense, which is one disadvantage. And there's no doubt that having somebody there can impact what's happening, that you can affect the behavior of those that you're going to observe. I mean, there's no way not to do that. What you try to do is strategies for minimizing that, but there's no way you're not going to somewhat affect. And honestly, as someone my age and my race, I can't go into every single group. There are many groups that I could go into, but there are many groups where I would not be the right person, and anything would shut down. So, there also has to be a little bit of a match there too, of where you're actually trying to do participant observation. And then you don't have a lot of control over the situation, and then people might act differently, of course, if you're there. So those are some of the disadvantages. For the work I do, I think there are way more advantages than disadvantages, but I think the key point is it's not just going in and watching and participating in what's happening, that there's actually quite a bit of preparation and quite a bit of note taking afterwards. Generally, you don't just go in with a clipboard and take notes. You have to actually, file it away in your head. And then, when you get to someplace else, maybe to your car after a meeting, that's when you might take write down your copious field notes. And if you've had a co-observer, that's where you talk with your co-observer and you debrief. And then the two of you might have seen different things and can have a conversation. Interviews, and Elijah did mention interviews. Those can be in person, they can be on the phone. They can be structured, they can be semi-structured, and there are many places where you can conduct interviews. You can just kind of randomly walk up to people. I've done that. And actually, people are generally pretty willing to talk to you when you explain who and what you're doing. But again, the time in developing a structured or a semi-structured interview guide can be really intensive. It's very similar to developing a survey. You have to really think through what it is you need to find out, and what are the ways that you can ask those questions so that you will actually get the information. So again, if you're not trained as a qualitative researcher, you might not have the full understanding of the amount of time and effort that goes into developing interview guides. So, and just to clarify, so semi-structured means that you ask very broad questions, and then you add questions in as people respond. So if can't think right off of an example, so you start broad, but then you know the issue well enough, or you know what you're trying to get well enough. Maybe you've done some participant observations, so you know enough about the context that you, as the interviewer, can ask the questions as issues arise, and you kind of know where you want to go with that. And sometimes it leads in very unexpected places. So again, that's where training and practice comes in. Often interviews are recorded. I'm actually a pretty good note taker, and I hate listening to my own voice. So I generally don't. I mean, I often record, but I generally don't need to go back to the recordings. They're really more of a backup plan. So, but nowadays you can take. This is what I record with now. I record. Oops, um, I record is on my phone. This is what I use to record now. Way different than it used to be when we had to, take recorders, and you had to have multiple recorders. I usually take my phone and my iPad if I'm recording, so I do have two backup systems. And note, if you're ever doing this, if you're ever using your phone to record, put on airplane mode, because if you get a call in the middle of your focus group, it will actually turn off your recording on your phone. Just a little helpful tip that I learned the hard way, except that I also had my iPad recording. So interviews, great data. It's rich. It gives you the opportunity to explore topics in depth, as I've just described. You really can experience the affective as well as the cognitive aspects of the responses. And so you can really get what people feel about it. And if they're just kind of giving you cursory, things where you can't feel that in a survey, but in an interview, you can really get the depth of the emotion. Again, it's very labor intensive, and it's actually incredibly draining. Like, it's really hard to do more 3 or 4 a day because of the attention that you have to pay. And just, because you're always thinking and always trying to figure out how to structure the next question while you're listening carefully, because you will miss stuff if you don't. So I can do 3 or 4 in a day, but beyond that, I just really can't. So you can see how that would limit how many people you can talk to. Even if I have a couple of researchers or staff members working with me, you just can't. I mean, there are only so many hours in the day. You also can adapt to the situation. I mean, a lot of times, especially with very kind of high-level folks, high-end organizations, sometimes they'll say they have 20 minutes, but then you get to talk to them and they really only have 10 minutes. And so, you are able to flex that, and just ask the really critical questions. Again, disadvantage is very time consuming. And you can, because you're flexible, you can be inconsistent across the interviews. and time to have interviews transcribed if you do that, but to actually sift through all the data and report it, and analyze it can be very, very time consuming. Focus groups are basically just kind of like group interviews, but they usually are between 8 to 12 individuals. The work in focus groups is in recruitment because you need homogenous groups. Like the whole design of a focus group is that whatever you're looking at, you need homogenous groups. So, so that's really, that's often very tough to get enough people together in one place, especially if you are not actually in the community. So you're relying on other people. So sometimes folks come to me and they say, we want focus groups, and I talk them into individual interviews because it can be a much easier, very labor intensive. But it's the recruitment that's really hard. And you can show up, you can do everything, and you might have 2 people. You might have 1 person. That's happened to me before. Then I just switched it to an interview. But yeah, very, very labor intensive. But the key is homogenous groups. Really careful planning into the discussion guide. And you really need to have a good amount of training to be effective as a focus group facilitator. I will say that working with Holly and Catherine at CARE, they have a lot of really creative ideas on strategies you can use with focus groups, but you have to lay that over this kind of really strong foundation of how to conduct focus groups. Again, and so we generally provide incentives for focus groups, and I mean, like $20 to $30, for people to come to focus groups, and we have pretty good success with that. But again, it's very labor intensive. I'm flipping 2 different slideshows. If you wonder what I'm doing, I have my notes on one monitor and then what you guys can see on the other. So document review, I gave you the great example of we review the action plans for Let's Go. So it allows us to, conserve the time of others. And actually, you can pretty quickly go through and review, 6 action plans and then summarize them. And then you can see what they've done in the next 6 months. And there are many, many kinds of documents that you could look at. But we always try to use any kind of documents that we can get our hands on, because all of the things we've talked about, focus groups, interviews, participant observation, I mean, that takes people's time. Whereas in addition to the researcher's time or the evaluator's time. Just really briefly, because I know we're getting close to the end of class, case studies, not often used, but we have, my dissertation was actually case studies. I looked at 5 children's homes where we'd done work in physical activity and nutrition, trying to change their environments. And case studies often can give you a really in-depth look at something. I had a student who did case studies with HYPE teams. So Kelsey mentioned the HYPE, the Youth Engagement or Youth Empowerment Program that's part of Eat Smart Move More South Carolina. She met with HYPE team leaders, adult leaders, and actually went to some HYPE team meetings for a couple of HYPE teams to really get a good idea and of actually how that process really works, and then wrote a real thick description of those HYPE teams, and wrote that up for Eat Smart Move More South Carolina. So case studies are another way. Another researcher who works with us did a case study that looked at the adoption of an evidence-based teen pregnancy prevention curriculum in a county, really as an example of how I mean, the press were involved. I mean, and how that unfolded and who were the key stakeholders. And she interviewed, I think, like 20, 25 people in the community to get a real thorough understanding of that process in hopes that that would really help other communities who wanted to be facilitating that kind of process. So town hall meetings, walking to, there are many other ways, feedback sessions, community talkback sessions. There are lots of other ways to get the community, to get qualitative data. And I think you guys gave really good reasons why you want to do it. But it really gives you that depth of understanding and that really insight into what's going on that I don't think you get with other measures. But again, I am really biased because this is what I spend most of my time when I'm not here in HSPM. This is what I spend my time doing, is designing or implementing qualitative evaluation methods. So I am biased. I actually wish I did a little bit more quantitative because I'm really starting to lose my skills. But the take-home message is it's important, but I suggest you partner with somebody who's well-trained to do this work. For example, Palmetto Health and DHEC actually asked me to come in, and I did the focus group training for all their focus groups. So if you've looked at their report, they did a lot of focus groups. So I actually worked with them and did trainings for actually did two different trainings. I did a training in Sumter and a training here in Richland to help train those who are actually going to do the focus groups. They were multi-hour, like 2 or 3 hour trainings. They were great. It was such a great experience because they had, I mean, that was a great collaboration, and it was a great experience of being able to contribute to this really important process that I believe in. So if you are going to be doing anything with qualitative methods, I suggest all of you, I hope you would reach out to me, no matter if it's 5 years from now, no matter if it's next week. I hope you would reach out to me. As you can tell, I'm pretty passionate about this and have, I don't know, 15, 20 years of experience in doing this. So I am more than happy to help any of you. And there are a ton of resources out there on qualitative methods. So that's my little mini lecture. Any questions? I could talk for days.
Yeah. We're right up here at 7
I
almost.
know, I know.